The internal use of clay, which consists of ingesting small amounts of clay on a regular basis, has numerous health benefits. It allows to treat gastroenteritis, heartburn, gastroesophageal reflux disease, hair loss, overweight, acne, anemia and constipation, to name but a few. Clay is rich in minerals. It remineralizes the body and fills in potential deficiencies. Furthermore, clay has absorption properties. Like a sponge, it will internalize liquids in the digestive system and capture particles, which it will then take with it during its elimination. Clay has also adsorption properties. It will bind on its surface to molecules by chemical bonds, ionic bonds, and physical bonds, van der Waals interactions. These absorption and adsorption properties allow clay to deactivate and eliminate toxins, such as aflatoxins, toxins produced by molds, pesticides, such as strychnine, heavy metals, radionuclides, such as cesium and strontium, dioxin, PCBs, bacteria, such as syphilis, cholera, H. pylori, Staphylococcus aureus and Salmonella, intestinal parasites, such as pinworms, hookworms and blood flukes, viruses, fluoride and ammonia. For optimal results, proceed as follows. First of all, buy a Montmorillonite type of clay powder, preferably. Montmorillonite clay is rich in minerals and has a high adsorption capacity. It is known for its purity. In the absence of Montmorillonite clay, you can buy Bentonite clay, which contains more than 70% of Montmorillonite clay. Ensure that it is green-colored or pale green, which means that it is high in iron, but not white, which could cause anemia. Do not buy white-colored kaolin clay, to avoid any risk of aluminum poisoning. In the evening, take the equivalent of a teaspoon of clay in a glass of water and stir, using a wooden spoon. Do not use a metal or a plastic spoon, as clay would interact with these materials, which would reduce its detoxifying properties. Also, do not use a metal or a plastic glass. Let it sit overnight, so that the liquid can decant. The next morning, the liquid will be separated into two layers. The lower layer, the residue, consisting of the clay particles, which have deposited at the bottom of the glass, and the upper layer, the supernatant, consisting of slightly cloudy water. During the first week of the cure, do not stir the liquid after its overnight decantation. Every morning, drink the supernatant, the slightly cloudy water, on an empty stomach and throw away the residue, the clay particles deposited at the bottom of the glass. A little tip: do not throw the residue in the sink, as it might block it. Starting from the second week, stir the decanted liquid to mix the two layers. Every morning, drink it on an empty stomach.